Gary, thank you. We don't need to be a doctor or even good at math to figure it out. UW Health has thousands more patients eligible for a vaccine than actual COVID-19 vaccines, and the math got even worse this morning.
Amanda Quintana is live at UW Health, where they've been forced to reschedule some appointments. Amanda, we know they're asking for more. Can they get it?
Yeah, well, Charlotte, there is some good news. Manufacturers are making more vaccines. So instead of the 70,000 a week that Wisconsin was getting, we're getting about 89,000 now. But that's not really helping us get through the whole population much faster. And there are hospitals like UW that are still operating shipment to shipment, almost running out of vaccine just hours before the next box arrives.
The ratio wasn't great yesterday and got even worse today. UW Health's dashboard showed just 93 first doses available with 22,000 people scheduled.
It's really apparent that there's just not enough vaccine and there's really a big mismatch.
UW Health did get another 2,300 doses later this morning, but the vaccinator still has to reschedule some appointments for later this week.
Certainly not something we ever would want to do. We certainly been advocating and attempting to get more supply, but right now that's a situation that we're in.
Dr. Matt Anderson says UW Health has been vocal with the state about how many older patients they have in hopes that DHS would give them more vaccine, saying it treats about 6% of all people 65 and older in the state. But DHS isn't taking that into consideration when allocating doses each week.
At 505 vaccinators asked for nearly 290,000 vaccines. And so we had to make a lot of tough decisions.
Many local pharmacies didn't get any vaccine this week. To decide where vaccine does go, DHS looks at geographic location.
We have a very high number of vaccinators in Dane County, which means that not all of them are going to get vaccine.
And how many doses vaccinators have the capacity to do each week. But still, UW Health says it has the ability to do more than double the amount of vaccines it's getting.
We could give in a couple of weeks here over 7,000 first doses and then continue to give our second doses. So right now the supply isn't anywhere near touching our ability to utilize the vaccines in greater amounts.
Reporters asked DHS today why they don't take into account how many patients 65 and older a hospital has, but they say they don't have that data. And they say they also don't have the data of how many people in a certain ethnicity hospitals have or how many people with underlying conditions. The DHS also said that Dane County is doing quite well. So even though it might feel like low supply here at UW Health, there are a lot of people who are 65 or older in Dane County who are getting vaccinated.